First of all, I'd like to begin by thanking the ChiroCongress for, one, beginning and having this event, and then two, for inviting the ICA and the ACA to participate. My presentation may be a little bit different than what you were expecting, and that's intentional. What I want to begin with is the need to change our culture, and the time is now. And I've been the president of the ICA now for 9 months, and about 6 months ago, one of the first things that I got my board to approve was some changes in adopting some value statements. And I want to touch upon just a couple of those. And you know, we have, as a international association, a vision to empower humanity and the expression of maximum health, wellness, and human potential through chiropractic. And we have a mission statement. The mission statement is to protect and promote chiropractic throughout the world, not just in the United States, but throughout the world as a distinct healthcare profession predicated upon its unique philosophy, science, and the art of the subluxation, detection, and correction. Okay. Now, we adopted 5 values, and I would say the most important one is respect. All right? And we have a history that goes back 125 years, and it just seems that there's always been at least two factions that have a tendency to disagree with whatever the other side says. And as our friend from the ACA indicated, we all have a DC degree. We're all in the same profession, and we have to learn to respect each other. We have to learn to respect, and we have to learn to have a civil discourse about those policy issues that we may have a different point of view on. And that's one of the things that, from my point of view, the ICA is going to try to take a leadership in making some of those changes. The other value statement is one of equitability. And I don't think there's anybody in this room that would have a problem with this. And I'm going to read this literally. And that we advocate for a healthcare system that is just, that is fair, and is free from discrimination. And that we believe that all people should have equal access to the services that promote health and well-being, including chiropractic care. We support the inclusion of all licensed health providers that are practicing within the scope and the standards of their profession, and advocate for compensation that is commensurate and fair for services provided. Okay, that's from a, if you want to call it from a 30,000 viewpoint, okay, something that I would hope and believe that everybody in this room can support. Alrighty, and then there's a statement about patient empowerment, the statement about collaboration and transparency. And I guess my point is the time for culture change is now. Now, I'm looking at it, again, I'm the president of the International Chiropractors Association. And I know there was some discussion yesterday about some things that are going on in Australia, in Canada, in Northern Europe. And my message is, and I'm here because that's something that I'm dealing with at the international level. And I need your help. All righty? And I think you need our help. And what I'm going to refer to is an author of a book called The Spin Doctors, which it's only recently I became aware of this. I think it was written 10 or 15 years ago. They're up from Canada. All right, and I think it was about May or June, my international director sent me, he's from Canada, and he sent me a podcast from Green Shield. And I think that's the equivalent of Blue Shield or one of the health providers in Canada. And I listened to it, and about 30 minutes into it, the author, Paul Benedetti, said something that I thought was profound. And that's when the light bulb went on. And this is what he said. He said, some chiropractors feel that there's a neurological benefit from a chiropractic adjustment that is just simply not MSK. And that opens the door to all kinds of treatments, because as soon as you creak that door open, you're back to D.D. Palmer. You are actually back to the idea that there is a relationship between the spinal adjustment and visceral disorders, and that gives license to a scope of practice that is all-encompassing. Okay, my friend.
Thank you.
Okay. My point is, that's how the opposition to chiropractic is looking at us. And it's kind of interesting because we tend to think of chiropractic either as narrow scope or broad scope, and we're looking at it the way we've always looked at it. The fact of the matter is, the broadest scope is what they're talking about. And that is what we do can affect everything because of the neurological component, because of the effect of the adjustment on the brain, yada, 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 yada. And so my point is, we are being attacked from outside the United States. All right? All right, and this is an example of a paper that was written that's suggesting we need to divorce ourselves and separate the vitalistic chiropractors, okay, from the mechanistic chiropractors. And I guess my message is, we need to keep this profession together. Okay, we need to have a focus on the vertebral subluxation correction, the utilization of X-rays, and pediatric adjustments. Okay. It is not just musculoskeletal, it's neuromusculoskeletal. And subluxation-based chiropractic is scientific and it is evidence-based. Because what that subgroup outside the United States is trying to frame the debate as you're either one or the other. And they're claiming that what we do in the United States, okay, is not evidence-based and it's not scientific. All right. Now, that said, with promoting an affiliation program. All right, now, I don't mean I want you all to affiliate with the ICA so that you're taking sides against the ACA. Has nothing to do with it. Okay, what I'm saying is, as the ICA tackles these issues on the world stage, okay, I need as many associations in the United States to be supportive of that effort on the international stage. Okay? Now, that said, culture change. The ICA agreed to abide by the ChiroCongress tenets. All right? I'm changing the culture in my own organization, okay? And I applaud the efforts of the ChiroCongress, alrighty? And we're going to get there. Now, that said, I'll briefly touch upon what our strategies are on Medicare. Simply, we want to maintain the current mandate for coverage of the adjustment to correct the subluxation. We want to remove the restrictive language used to limit reimbursements to the adjustment only. But we also want to mandate coverage for exams and X-rays. Right? We want to introduce the concepts of Section 2706 and eliminate discrimination based upon licensed provider type. We want to maintain economic neutrality by removing barriers to reimbursements for existing services only. We want to establish equitability in reimbursement rates to other physician-level providers. And then we want to eliminate discrimination that denies the patients of chiropractic physicians the ability to privately contract. Okay? The bottom line is we are firmly committed to ending discrimination against doctors of chiropractic and Medicare. It's that simple. Now, as was alluded to earlier, we have different strategies. Okay, and I believe there's a value in the ICA pursuing its strategy, but not interfering with the other organizations that are still pursuing the same overall goal. We need to get change in Medicare. We need to eliminate the discrimination, and we're going to have to do it by collaborating with each other, working together, and that's the only way it can happen. So that's my message. And in the future, again, I'd like to have more cooperation and collaboration between the ICA and everybody in this room, and including the ACA. And I'd like to thank you for the opportunity to address the group.